Hello everyone, today we have with us Maitreyi, and she works in a space that doesn't get its due credit and doesn't get talked about much. So I'll pass it on to her to really educate people the area she works in and how important it is.
Hi everybody, I'm Maitreyi. I'm the CEO of Argala Health. Argala is a post-op care, pain management and medical rehabilitation center. We are currently based out of Hyderabad, where we cater to physical rehabilitation in our state-of-the-art base center in Jubilee Hills, and we also do home health for patients who really can't travel all the way. Of course, our main intent of getting into this space in healthcare is it's not very talked about. Medical rehabilitation is also not very well understood right now in India. But the basic premise of completing recovery, whether it's linked to a fracture, a surgery, a condition that you are currently treating with medication, only gets complete when you have rehabilitation attached to it. I think some of the most commonly spoken terms in the rehabilitation space right now is sports rehab, right? So you do have a lot of sports medicine and sports rehab related centers, which of course we are into too. But some of the most uncommon heard treatment areas are medical rehabilitation for pulmonology, cardiac cases, let's say patients who've had heart attacks, MI episodes, strokes, etc. They go in for surgeries, they're put on preventive medication for a long time. But your heart definitely needs the fuel it had before for you to come back in full energy, and that's when rehabilitation plays a very important role to complete your recovery. It definitely goes hand in hand with what patients are going to hospitals and are getting treated by doctors for. Pulmonology is one case that we've just picked up. It's quite niche. Thanks to the environmental factors, air quality, lifestyle changes and habits, people suffer more and more now with pulmonology, related diseases. And unfortunately, the awareness that a rehabilitation can help you, along with, of course, your medication and doctor treatment, is not yet still prevalent in India. And the reason we chose this space and the reason we want to cater to it being super exclusive and not deviating into anything else is because we want to bring in awareness. We want to be monopoly. We want to, we want it to become as big as what main healthcare now is in India, right? So of course we started with Hyderabad because that's where our home is and easier to understand the market and penetrate. But the plan is to go global and of course across India soon. Digital plays a huge role because I think preventive care on digital media is right now the most trending amongst most of the users who consume digital media, right? From people who buy peptides to enzymes online to just buying dermatological products and dentistry products online. They think that Instagram and Google shopping is better than going to a doctor, which is what we want to leverage. We love it that people are consuming digital media, and we want to throw in awareness that on why medical rehabilitation is important, right?
So that's like to understand who exactly is your target audience here.
Right. So, I mean, our target audience is somebody who's as young and let's say has had an ortho injury or is suffering from asthma, to extremely old patients who have had a surgery, a knee replacement, hip replacement if it's in ortho, if it's in cardiac, people who've suffered with stroke, MIs, pulmonology, who have severe asthma attacks, etc. Neuro is extremely major in our case. Spine surgeries, brain strokes, neurological damages. People can't walk and have lost hope. We bring back the hope in doing rehab continuously. We help. We have patients who 6 months ago who had like brain strokes weren't even able to move their fingers, but now they walk. Paralysis, CP. These are the kind of audience that we have. But what we're also majorly catering to when I spoke about awareness is the geriatric and the corporate population who majorly suffer pain and it becomes chronic into some condition like arthritis because of lifestyle changes and their muscles are degenerating, right? So geriatric pain management and ergonomic rehabilitation amongst corporates. I'm sure you, in your circle too, you'll have a lot of people who just say, I have a neck pain,
Yeah, yeah.
I have a tennis shoulder, back pain, etc. All these are just ergonomic conditions.
Something that people live with.
They just live with. It
Yeah.
becomes chronic when they're after 50.
Right.
Or they prefer popping painkillers,
Yeah.
which will lead to some other organ issue. Of course, I mean, I don't deny that, this is important, because there are a lot of conditions where you can't really go about without consulting a doctor and taking,
Yeah.
medication, right? But medical rehabilitation alongside with consultation doctors helps you gain back the strength on your muscles.
So how does it really work when someone comes to you, let's say post surgery? So your experts talk to their doctors and come up with a solution that can help them.
So we believe in a 360-degree approach. There is no way that any of our rehabilitation is done without the consulting doctor. So in every rehab care plan that we make, which is personalized, there is a rehab expert who's a physiotherapist from our side who's involved, a clinical doctor, but the consulting doctor too, to understand the do's and don'ts, what we can do.
And the patient history
Yes,
and
absolutely.
everything, yeah.
And of course, we're reporting back their progress on a continuous basis to the doctor. So that's the way we proceed.
Okay. And when it comes to the affordability side of it,
Yeah.
Can a person, I mean, if you can just shed light on it, that, so a lot of people tend to believe that, I've given so much money in my surgery and I cannot afford another supportive treatment, so to say, because the core has been treated and now it's their way of their journey ahead. What do you have to say to them?
So for this, I would only like to now thank hospitals and doctors who are also actively promoting rehabilitation, right? They're now, most of the hospitals and doctors are now making rehab and post-op care a part of the package right from the time the patient walks in, just to understand, the first consultation before the surgery. So I think patients of late are now understanding that this is important to finish the recovery. Most of the hospitals have this as a part of the package. Otherwise also, doctors are actively taking time out to explain to the patient on why it's important, why movement is important for complete recovery. So that is a huge plus for us. And I would like to thank the medical fraternity, to bring in all this awareness across. Coming to, affordability, we are trying to build one of the most premium rehabilitation centers, right, across in India that has ever been, which means we have state-of-the-art equipment that no one else has. But we also want to make it extremely affordable. The reason why, we are like a Coke tin, but everybody can afford it, is because we want everybody to have access. The reason we are in healthcare is to give access and recovery and hope to people, right? But we're also trying to make it premium, just to make sure that the recovery is better for people and it's complete. So I wouldn't be able to term it as if there is only a certain section who can.
But you are trying to
we
cover
are
as
fitting
many
in
people.
everybody, yes.
Thank you so much.
Thank
That was a
you.
lovely conversation.
Yes.
And thank you.